This video shows the final moments of 38-year-old Othel Moore's life. His family says he died alone in a Missouri prison, neglected when he needed urgent medical care. It hits close to home for Tempest Williams.
It's ridiculous.
Her boyfriend is incarcerated for a probation violation, and she worries his basic medical needs are being ignored. She says he recently begged for oral surgery at a St. Louis County prison.
He said wisdom tooth causing extreme pain, and clearly you can see they didn't put nothing on here.
Instead, she says he was written up and put on lockdown. When she finally saw him, she could feel his anguish.
I'd never seen my man cry. He had tears coming down his eyes, excruciating pain.
This kind of suffering isn't just affecting people behind bars. It's costing Missouri taxpayers millions. Since 2020, data shows Missouri's Department of Corrections has paid out $68 million in lawsuit settlements. Those lawsuits, filed by contractors, inmates, and former staff, alleging everything from employer misconduct to abuse. To dig deeper, the I-Team interviewed prison reform advocates across the state. Among them, Mallory Rush with the nonprofit Empower Missouri.
What I don't want my taxpayer dollars to be used for are paying out lawsuits to DOC staff because the department does not have appropriate controls in place to prevent abuses in their facilities.
Others, like Lori Curry, say the data we're exposing reveals a system failing from within.
It's getting worse every day.
What are the changes that need to be made?
We are really pushing for legislation that would implement an independent department in the state.
In 21 other states, including Illinois, advocates say independent agencies that inspect facilities and respond to complaints have reduced abuse and saved taxpayer dollars. A corrections spokesperson declined an on-camera interview, but said in an email that the department is constantly making improvements, citing new body scanners to block dangerous contraband. They added, "The narrative that people in Missouri prisons don't get adequate health care or are more likely to die is simply false." But many argue that the facts tell a different story. Inside Missouri's prisons, about 12 people die every month,
which is the highest we've ever seen, and it just continues to rise.
Why is it getting worse?
You've got 2 nurses working a facility with 2,000 individuals, and people aren't getting necessary medications like mental health meds, cardiac meds, epilepsy medications, things like that.
A corrections spokesperson says the prison death rate is actually lower than the rest of the state, with most deaths attributed to natural causes. But people like Williams want more oversight and transparency from the Department of Corrections.
I feel like they got power and they take advantage of it.
Prison reform advocates argue that an independent watchdog could prevent abuse and reduce taxpayer-funded settlements by enforcing accountability. It's now up to Missouri lawmakers to determine if that oversight is necessary. For the I-Team, Paula Vasan, 5 on your side.